Hi family and friends. I just wanted to make this little video message and videogram because I don't know to what extent I've updated everybody. Every person's probably gotten a different update or has missed something just because the past 2 years has been super hectic and a lot has gone on in the past 2 years. So I just wanted to make a video so number one, people could see my face, so people know that I am doing well, and to just to explain everything that's going on and how I'm doing right now. So in 2017 or in 2017 or 2018, I was introduced to the idea of going through with the curative treatment for sickle cell disease. I was diagnosed when I was a baby, and since I was 1 year old, I've suffered from really bad pain crises and multiple hospital visits and a whole bunch of stuff. So it was brought to my attention in 2017 or 2018, around that time, that CRISPR had been very effective in gene editing therapy and had been curing patients of sickle cell disease. So I was really interested in that, and I pursued it in 2020 after I graduated from college. I was introduced to a trial using CRISPR technology to basically suppress the development, or I guess suppress the production of the sickled hemoglobin and increase the production of fetal hemoglobin in the body. And that was a small change that they would make in the DNA to tell the body make more fetal hemoglobin versus sickled hemoglobin. And the protective qualities of fetal hemoglobin would basically cure you of the symptoms of sickle cell disease, and it would cure you from having sickle cell crises and pain, which is the main thing I think that these trials are trying to achieve, is reduce the amount of sickle cell crises and just cure a patient of sickle cell disease. I was not eligible for that trial. I ended up doing a whole bunch of tests, and I was not eligible for that trial in 2020. The nurse coordinator who was helping me throughout that process with scheduling tests and stuff, she told me in the clinic that there would be another opportunity for another trial using the CRISPR technology for gene editing therapy, and to just wait because they're still trying to get everything figured out with the FDA, that they needed time to pretty much I guess give the okay. So I waited and I waited, and in 2021 my pain crises started to increase in severity, and they started to increase in how often I get them. They were starting to become very frequent, so they increased in frequency. And in November 2021, I had met one of the doctors leading the trial, and he pretty much said that it was time for me to pursue this curative treatment, and I agreed, my whole family agreed, that it was just time to be a part of this trial. Now, this trial is the first done in humans, phase 1 trial. I was the first patient, so I was reminded a few times that this was going to be the first human getting this done. And this trial was very different from the rest of the trials, even though it was gene editing and it still used CRISPR. This is how it's described on this article from Gene and Gene News. This trial, the first investigational therapy to use a gene correction approach to correct the SCD, sickle cell disease, point mutation in the beta globin gene, resulting in decreased sickle hemoglobin production and restored adult hemoglobin expression. So the point of this trial was to completely take down the sickle hemoglobin production and to increase the normal adult hemoglobin production. And it was truly curative, because the way that they cut the gene in the DNA was to take out whatever in the DNA was telling the body to produce sickle hemoglobin, and they replaced it with something that told the body to produce adult hemoglobin. Instead of toying with the production, they were trying to tell the body to make something completely different. And I kind of want to explain more about that process and the science behind it, because I might not be explaining it all correctly. But that's pretty much what the trial was. And the nurse coordinator from the previous trial, I believe it was her that said it would probably be a better fit, or maybe it was the doctor from the other trial that said it would probably be a better fit, because I wasn't eligible for the previous trial because my fetal hemoglobin was already naturally really high, and it probably wouldn't have worked. Essentially, I probably still would be having issues. But yes, I signed on to be part of that trial in 2021 of November, and the transplant was scheduled to happen after I had done a few rounds of apheresis. So apheresis is different from a blood transfusion, because in apheresis, blood is taken out of my body, my blood is being cycled out and is being replaced with donor blood. And it takes about 6 or 7 bags of blood for me. So I had to get a port to basically suck all my blood out, and it would be replaced with donor blood. It was this whole cycle. So all of my blood essentially would be replaced, and I should have hemoglobin A all throughout my blood and in my body. And the point of that was to make sure that I was healthy leading up to the transplant, to reduce the amount of pain crises, which ended up not working as efficiently as we thought it would be. I still ended up having some pain. But I did the apheresis once a month, and it was also in preparation for the stem cell collection. So that's another thing about this transplant, is an autologous transplant, which means they used my own stem cells to transplant back into me. And the stem cell collection happened in the hospital over the course of 3 or 4 days. And I ended up collecting a lot of stem cells. It was really successful, which was like, it felt good to start that process and have a bunch of stem cells to be edited, because in the process of editing your stem cells, they go through a lot of trauma, a lot of damage, so a lot of the cells end up dying or end up being bad. So let's say you collect 30 million stem cells, it might jump down to 10 million stem cells that'll actually be given back to you because of the 20 million lost stem cells because of their damage. So I started with a good number, and I came down to a decent number, but pretty much the more the better, and I was able to collect a lot of stem cells, so I was really happy about that. And then it was time for them to be edited, and my stem cells were sent away to be edited, my DNA was edited, and it was time for the transplant. And my actual transplant happened August 9th of 2022, and the stem cells, the actual transplant was pretty anticlimactic. It was a little IV bag, maybe about this big, and it was clear. And they infused these edited stem cells in my body within like 15 minutes. But my family was there through Zoom. No one could come in and visit me while I was in the hospital, but I did have my family there and a whole bunch of doctors and nurses who were rooting for me and interested in the process in the room with me. Which was nice to have that support. They gave me a happy transplant day poster. I had a lot of support that day. But I skipped a little bit. Before the transplant, I was in the hospital doing chemotherapy for about a week, which was a lot harder than I guess I had anticipated. You know, when we talk about chemotherapy, there's a lot of cancer patients who end up using more than one type of chemotherapy drug to get the cancer out of their body. I only needed one because the chemotherapy's purpose was to just wipe out my bone marrow, so that when they would replace the edited stem cells into my body, it would replace the old bone marrow, and those stem cells would kind of latch onto the bone marrow and start producing on their own. So I think the initial thought was that you're only gonna have one drug. It's not like a cocktail of things. It's only for a few days. It should be fine. It was difficult. I don't think my doctors really anticipated that I would react so badly, but it was tough. So I was still struggling with side effects after the transplant that happened on August 9th. And I stayed in the hospital for quite a while after that, because when I was in the hospital immediately after the transplant, the doctors start looking for signs of engraftment. And the first thing they were looking for was my ANC, which is a type of white blood cell. And they were checking to see if my ANC would go up and be stable on its own, which hinted at that my cells were starting to produce, that the stem cells that they put in my body were starting to reproduce on their own. And that took a while, and it took the help of an injection, a daily injection, for my ANC to go up, but it did. And I was able to get out of the hospital in about 2 months. And after that, the next step was looking for platelet production, because while I was in the hospital, I needed a platelet infusion pretty much every night for a while, and I needed blood transfusions really frequently, every day, if not every other day. So that was the next thing they were looking for, were my platelets to go up on their own and to stabilize on their own. But when I was out of the hospital, I stayed close by, and I had appointments maybe 2 or 3 times a week. And these weren't just, only one of those appointments a week was a casual check-in, but everything else was a day hospital appointment. And those appointments lasted all day because I needed platelets, and that process was just really long and grueling. I even developed an allergy to the platelets, to donors' platelets at one point, so that process ended up being really tiring in its own, and it started to become really concerning for I guess the scientist and my doctor, because I was super anemic still, and my platelets weren't engrafting, and the platelets they did give me, they weren't lasting very long. There were some times where I'd have to go get a platelet infusion 2 days after I already had one, and they just were pretty much saying they can't keep me in that state for too long. It's too dangerous. I was very high risk once I was out of the hospital, because my counts were very low. I couldn't go into restaurants, I couldn't go to the grocery store. I had to wear this big old mask that looked like a gas mask. I couldn't really see anyone. I was on quarantine for a long time. Thank God I didn't get sick the whole time, but it was just too high risk. They didn't want anything bad to happen, and it just wasn't safe. So around December, I was kind of put between a rock and a hard place, and they told me that I might have to consider getting my old stem cells back, because during the stem cell collection, they collected backup cells, which would entail that I would have sickle cell disease. I would have gone through this whole process, through the whole trial, just to still be stuck with sickle cell disease and these horrible pain crises that happen really often. And that made me so uncomfortable. Of course, I was in this trial for a reason. I didn't want to have sickle cell disease before. It started to become a matter of quality of life. My quality of life was slowly starting to go down. It was just too much of a hassle. I was in the hospital too often. I was in the clinic too often. I was in the ER too often. So actually, a day where they had said, hey, come into the clinic this day to kind of tell us your decision on what you want to do. It kind of was like I didn't really have a decision, though, because if my platelets weren't engrafting, if my bone marrow wasn't producing cells, I was gonna have to get my stem cells back eventually. But the day where I was supposed to kind of make a decision about it, my platelets went up. Yeah, my platelets went up, finally. And my doctor was like, okay, your platelets went up, your reticulocytes went up, and reticulocytes are precursors to cells. They are baby cells, which means things are being produced. And he was like, okay, well, we can wait a week. Just think about it. You still might have to get your stem cells back. But we waited a week. Platelets went up, reticulocytes went up. The reticulocytes was really the thing that was really exciting, because they were precursor to cells, and it said my bone marrow was active. And even before that, we had done a bone marrow aspirate, which is where my doctor would collect bone marrow from my hip bone, and we'd go in and he would see that the cellularity was low, which meant my bone marrow was empty. There were no cells there. But after my platelets went up, we did another bone marrow aspirate. My bone marrow was hypercellular. It went from being empty to being full of cells. I get so excited when I think about it because it was so devastating to think that I would have gone through all that and still have sickle cell disease. And I still would have had to struggle with everything that came with that. And it's a long list of things I was struggling with. But my body was starting to produce cells. And it was with the help of a medication to increase platelet production, but it worked. It took a while for it to work. The average time was like 4 to 6 weeks. We checked my platelets 4 weeks after taking the medicine. This was in winter, around December, November time. It wasn't doing anything, but by January, my cells decided that they wanted to grow. And my bone marrow decided that they wanted to grow and produce cells. And it just was so exciting. So since January, I have been feeling like I'm actually in recovery. I've been feeling like this is it. This is the part where I start to feel the effects of this trial. And I can see it because my sickled hemoglobin before the trial was at 80 to 90%. So that it was 80 to 90% of my cells were in the shape of a sickle. Now, my sickled hemoglobin percentage is 8%. It's that low. Way lower than sickle cell trait level. They were shooting for sickle cell trait level, which can be 40% sometimes. My sickled hemoglobin level is 8%. Everything else is fetal hemoglobin and normal adult hemoglobin, hemoglobin A. Now, this trial, it paused once they figured they might have to give me my stem cells back. And then a few weeks later, they ended it. They didn't see it as a success. The sponsors thought, this is our first patient. She's not responding well to the product. It didn't work. It took her too long. She was neutropenic for way too long, and we can't have her be in that state. But my sickled hemoglobin is practically non-existent. And I'm feeling better. I'm starting to actually feel better. I'm feeling like I'm recovering. I'm having less and less pain. The feelings of tiredness are starting to go away. I'm just starting to feel better. And I think the sponsors for the trial saw it as a failure. And I think some people, some doctors and nurses that I know who don't know like everything that's happening, who aren't fully updated on my situation, have come to me and said, I'm so sorry how things went. Like I know. And I'm like, sorry? Don't be sorry. I'm healed. Okay? And I feel good. And that's where I'm at now. My platelets are still going up. My reticulocyte count is very high and going up. And ANC is looking good. My white blood count is looking good. My red blood count is looking good. I'm not normal yet. None of my levels are normal, really. But I'm going to get there. It's going to take some time. But I'm feeling good. And I just wanted to show my face and tell people that I'm feeling good and summarize everything that's been going on. And I'm going to be 100% soon. I feel it. I feel it. And I also just wanted to say how grateful I am for my family and my friends. I feel so supported and so loved. I've always felt supported and loved. But the amount of people that have been praying for me and reaching out to me and just been loving on me has been wonderful and has really gotten me through. The hospital stay was not easy. It wasn't easy having to deal with those chemotherapy side effects. It wasn't easy being in quarantine and not being able to see family really while I was in the hospital, even though some did come sneak in towards the end of my stay. It was tough, but I felt lifted up. Yeah. So I just want to say thank you. Okay. Maybe I'll do this again, though. Maybe I'll do this again. I could do another one. I could talk about the trial. There's so much I have to say, and that's the truth of it. There's just so much I have to say about what's been happening. And this was like a way for me to kind of just get it all out a little bit about the schedule of everything that went down. There's still more to say.
his heart? How does his heart sound? His heart